Hi, I'm Olivia Henton. I'm a senior at Olmsted Falls High School, and I'm part of the pharmacy internship program, and my project is on common OTC drugs and their potential hidden risks throughout pregnancy. First off, over-the-counter or OTC products are drugs that are readily available to the public due to the fact that they can be acquired without a prescription from a physician. As a direct result of this accessibility, OTC drugs are often misused by patients. Many also mistakenly believe that simply because certain products are indeed over-the-counter, they are not harmful. One such group of people that are at high risk to misuse these drugs are pregnant women, as an adequate amount of information and testing is not available to validate a drug's safety for that population due to many ethical issues. The Food and Drug Administration, or FDA, regulates the labeling and status of all OTC drugs. The FDA utilizes a risk rating system that dictates the level of safety of a drug for pregnant women. However, this system is not yet featured on drug labels and is widely unknown. We hypothesize that perhaps the misuse of non-prescription drugs by the expectant population that may potentially harm a fetus can decrease by initiating a program that assists in guiding pregnant women in self-medication and by creating and standardizing an OTC drug label that features a section directed at that group of patients. In order to conduct this research, one therapeutic drug class will be analyzed. One drug that is known to be safe for use during pregnancy will be reviewed, as well as a drug that is known to be toxic to the fetus if administered during pregnancy. We will review these case studies conducted on each respective drug to validate their risk rating. In addition, a survey will be administered to the ambulatory pharmacist of the Cleveland Clinic. Their responses will provide valid opinions on non-prescription drugs and aspects associated with those and their use during pregnancy. The therapeutic drug class chosen to be analyzed is that of pain relievers. The chosen drug that is shown to be safe for use during pregnancy is acetaminophen. Acetaminophen is an analgesic or a pain reliever and an antipyretic, a fever preventer. A brand name drug commonly used that contains acetaminophen is Tylenol. The FDA has assigned acetaminophen a B for its risk rating. A B simply reflects the fact that during animal testing, no harm to the fetus of an animal was observed when acetaminophen was administered. A rating B could also indicate that animal testing resulted in adverse effects to the fetus. However, administration to humans resulted in no adverse effects to the fetus. One such case study that can validate acetaminophen's safety level includes a study conducted by a teratology service in England. The study was looking for a correlation between acetaminophen and infant complications. 300 women were evaluated retrospectively, all who had overdosed on the drug at some point during their pregnancy. 72%, or 216 fetal outcomes of these 300 women, resulted in normal infants. Normal simply indicates that there were no malformations, spontaneous abortions, or fetal deaths among these infants. The study concluded that a correlation between the drug and infant complications did not exist. The chosen drug that is shown to not be safe for use during pregnancy is aspirin. Aspirin is an NSAID, or a non-steroidal anti-inflammatory drug. A common name brand drug that contains aspirin is Bayer. The FDA has assigned aspirin a risk rating of a C. A C indicates that animal testing has resulted in adverse effects to the fetus and that no reliable studies have been conducted on pregnant humans to test its safety. One such case study that was reviewed to validate aspirin's rating of a C was one conducted by Blyer and Breckenridge. They tested aspirin's potential risk of infant hemorrhaging if administered to a pregnant woman at risk for gestational hypertension. All women consumed aspirin 1 week prior to their delivery. In the experimental group, 3 of 14 infants, or 21.4% of infants, who had been exposed to aspirin suffered from minor hemorrhaging. The control group, or those who had not been administered aspirin before delivery, produced contrasting results. Only 1 in 17 of the newborns, or at 5.9%, suffered from minor hemorrhaging. The study concluded that a correlation between aspirin and adverse effects to a fetus if given during pregnancy did indeed exist. Both a survey and a weighted survey were administered to the ambulatory pharmacist of the Cleveland Clinic. The results from the surveys were utilized to form conclusions and solutions. The first survey consisted of 4 multiple-choice questions and 2 extended response questions. The first question pharmacists answered was, how effective do you believe the current OTC drug label is? Receiving the most votes were the answers effective and fair. Effective at the necessary information is included but not always easy to read, and fair meaning information is included but more information would increase its effectiveness. Each of these answers received an equivalent amount of the votes at 36% of pharmacists. The remaining results include 7% of pharmacists stated that the OTC drug labels are extremely effective, and 21% stated that the drug labels are not effective at all. The next question that pharmacists were asked: how often are you questioned about OTC drugs by pregnant women? In a disturbing majority of responses, 43% of pharmacists responded that they are rarely, or a few times a month, sought out for self-medication guidance by pregnant women. 36% stated that they sometimes, or more than once a week, are questioned. 14% stated that they are routinely questioned. And finally, 7% of pharmacists stated that they are never sought out for OTC guidance. Question 3 asked pharmacists which drug class pregnant women asked about most often. Most, at 36% of pharmacists, stated that pain relievers are asked about most often. Results illustrate that antacids are asked about the least. The final question asked ambulatory pharmacists whether or not they believed the FDA's risk rating system was effective or not. Data has resulted in a stalemate. 50% stated that yes, they do believe it is effective, while the remaining 50% do not believe it is effective. Other data compiled from the extended response questions include: 1. While counseling a pregnant patient on OTC products, understanding the trimester they are in and other medical conditions coinciding with the pregnancy are vital things that need to be known as well. In addition, another healthcare provider should be consulted in addition to a pharmacist. Several also provided suggestions as to what can be changed on an OTC drug label to improve its effectiveness, and here are a few examples. Next, a weighted survey was given to the ambulatory pharmacist of the Cleveland Clinic to estimate the OTC knowledge of the average pregnant patient. Out of a possible 24 points, where the higher the score, the more at risk for misuse of drugs the patient is, pharmacists responded with an average score of 16.71. An average score of 16.71 indicates that the average pregnant patient has a fair amount of knowledge on non-prescription products. However, the average patient does not have a complete knowledge of the potential dangers of these drugs. Pregnant patients should thus be advised to seek further drug counseling in order to not only increase their knowledge, but to also assist them in a safe pregnancy. With the data gathered from the survey, I have concluded that the OTC drug label needs to be improved by simplifying and standardizing it. In order to do this, the directions section will be highlighted in place at the very top for easy navigation and self-medicating. In addition, directions will be in a chart format featuring a row specifically for pregnant women. Finally, the risk rating will be included on the drug label along with an insert to educate the patient on the meaning and significance of the assigned rating. In order to prevent and improve the self-medicating process of pregnant women, I propose that the Cleveland Clinic ambulatory pharmacies designate space in all their OTC areas of their pharmacies to serve as a reference and aid center specifically for pregnant women. The space will be called the Safe Storage Station, and products in this area must have a risk rating of a B or above in order to gain admittance. In addition, pamphlets will be readily available to educate the patients on OTC safety, adverse effects of drugs, and proper use. Here's an example of what the inside of a pamphlet at the Safe Storage Station might look like. Here are my references that I used in order to conduct this research project. I would like to thank Mike Waskovich, Sabrina Spikes, and all the ambulatory pharmacists of Cleveland Clinic for all of their help on this project. I would also like to thank the Office of Civic Education for allowing me the opportunity to participate in this internship.